Thank you so much. Really appreciate the introduction and appreciate the opportunity to speak. It will be an interesting morning, hopefully, for the attendees. If you're not used to doing a lot of medical talks, this actually is a medical talk really to lay people. And my goal is to have you become a statistician and plant-based nutrition and to understand why. And then I've got one request for you all. If you listen to what I have to say and you're impressed by things that you weren't aware of, perhaps, you might want to jot some of it down. You might want to do some screen captures and then take the information to your doctor. Because I'm going to start off by saying that the leading cause of death of physicians, including cardiologists, is heart disease. And so we really do have to work on our physician community. And I'm actually using all of my patients on whom I'm consulting to go back to their referring physician and try to change their life and change their practice. We can crowdsource this thing. So anyway, I'm going to start talking specifically about cardiovascular risk factors. And this used to be a talk about nutrition and cardiovascular mortality, meaning dying of heart disease. And then COVID-19 happened. And one by one, all of our cardiovascular risk factors that I'm going to talk about, it turns out that they are the same risk factors for having a bad outcome with COVID-19. And so I'm going to go through that data just so that everyone's clear that we live in a dual pandemic. And yes, if we were to do the right thing with our lifestyle, the impact of both of them would be markedly diminished. So starting with COVID-19, everyone is really has understood this to be an issue of people who have underlying disease do much worse with COVID-19 than those people who were healthy and younger, for example. But heart disease, diabetes, this was really within the first couple of months, people recognized that those are the people who end up in the ICU on a ventilator and passing away. And then the data started to become even clearer that after a month or so here in Chicago, for example, it wasn't evenly distributed in terms of death. Everybody can get COVID, but not everybody was dying of COVID. And when you look at the Latinx community and the African American community, those were the blips. You saw it terribly in New York as well. And just in the first 4 months, there had been a lot of lives that were lost, and this ratio of African American to white has really not changed. And so it's, what is really driving it? It's risk factors. And so we're saying that really from the beginning that if you're doing plant-based nutrition, you have less obesity, diabetes, hypertension, high cholesterol, and cardiovascular disease, and therefore you have a better shot of having your immune system fix it. Okay, so then the data started to come out. People were putting all this data together. We did some at Rush. We did, and there are multiple publications all saying the same thing. And that is, you may not know what a hazard ratio is coming into this talk, but you're going to see so many hazard ratios. If something has no relationship to another, it's going to be a 1.0. If there was something that actually is reduced, it would be like less than 1. In this case, 22% reduction would be a 0.78. And so what this is really saying is that if you do all of the modeling, because everyone was saying that blacks were dying faster than whites. Well, it turns out it's not actually true. If you look at a model that includes every kind of risk factor that you can imagine, it turns out that being black was about an 11% protection from dying. The problem wasn't the race, the problem was the risk. And so what we needed to do was take our African American and our Latinx communities and get rid of the risk factors, and then the deaths would go away. And so ultimately, people realized that being black was not associated with a higher death rate. If you adjust for all of the factors that lead to death, it wasn't about being black. Well, I'm going to globalize this for a moment to talk about cardiovascular disease, which is what many of you came here to listen to, and point out the facts that really about 50% of African Americans actually have some form of cardiovascular disease. But it's a blight on our entire country. The amount of money that we spend each year on heart disease, we could wipe out all the student debt and everybody could go, to college for free. There would be no limit to what we could accomplish as a country and a community if we were not saddled with this. And it really is, I'm going to try to convince you that it's a global problem. You can see it all over the world. You can see that people are eating unhealthy diets. not just in the United States, and numbers saying 11 million people died a few years ago because of what they ate and not doing too much sodium and not enough whole grains. And I wish I had caught you all before breakfast so we can increase the amount of fruits and vegetables that you're eating and lower the animal products. But let me get particular about this heart disease issue. I went into cardiology because of this curve. That is, when I was training in the early 70s, we were starting to see the beginning of all of this stuff going down, bypass surgery. And I was at Emory when Andreas Grunzik came in and started putting balloons inside of arteries. And everyone's heard of someone who's had a stent or someone who's had a angioplasty or bypass surgery. All of these things are amazing. But you know what? You're going to get to a point where you can develop all of these techniques and you're still going to have more heart disease than you have everything else. And it's not that we failed. I wouldn't say a 70% reduction in cardiovascular death in the United States over the last 40 years is a failure, but it really isn't it didn't get us to where we wanted to go, point A. And point B, in about 2015, the decrease stopped. That is, as inventive as we were, the population and their ability to develop disease really caught up with cardiology. And I really do have patients who come in to see me after a heart attack. And when they're coming in saying, "Doc, give me some pills so I can go back and do the things that got me to your office in the first place." And that's really where we need to change things. And let me just point out, when you look at that curve of going down, 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 and then the down going stops in 2015, same thing's happening in the Black community. Our getting down to a particular death rate is about 11 years later, and it's about a 21% increase in cardiovascular death in the African American community. And so I'm always telling that, I wanted heart disease to be number 2, not with COVID. It did make it to number 2 because of COVID in 2020. But I wanted it to be because our African American population got down to just where everyone else is in the United States, horrifically high, but not 20% worse, and we would have gotten there. But everything that I've talked about so far was really about mopping up the floor instead of turning off the faucet. And so at some point, we have to deal with the cause of the disease, not just really fancy mops. Okay, I have to admit it. We have some fantastic mops in cardiology. Come to Rush, you will find the best mops ever. Okay, and we do stents and angioplasties, and put in valves through the leg, and radio frequency, ablations and cryoablations. We do fantastic things, but we really, as a community, need to focus on preventing the illnesses so that Rush cardiology doesn't have as much to do. This is a problem all around. It was interesting that when Wall Street Journal wanted to talk about this, they really came out and talked about the African American experience, because we are dying at an earlier age than everyone else. And it really is these 4 factors, the same ones that hurt people with COVID: obesity, diabetes, hypertension, and high cholesterol. We have guidelines. It was great to be in the room with these 17 people and try to put guidelines together, and learned a lot from them, try to contribute a whole lot of dietary stuff. But, if people make a choice to smoke, they choose what to eat. They choose whether or not they're going to have their blood pressure monitored and managed. And these are choices that everyone makes every day. What I try to tell my patients is that you're not making, unless you live alone and you're independently wealthy, you are interconnected with other people. You have a family, you have people who, if you have a stroke, they're going to have to take off of their job to go take care of you. So you're impoverishing your entire family, whoever in your community, in your church. The pastor is trying to run around and take care of people in the hospitals, can get overwhelmed. Why don't we take our own responsibility and do pay attention to these 7 things? And if we do that, then that really is, personal responsibility. Okay, I want to talk a little bit. You're going to see me going back and forth because of the interlacing of heart disease and COVID. I'm going to go back and forth between COVID and cardiovascular disease. And one of the studies that was published just last week talked about smoking and weight. And we hadn't focused on the smoking before, but it really does worsen COVID illness, because it does have an underlying lung issue that is really what's taking people out, as everyone knows. You can put someone on a ventilator, you can turn them upside down, so-called proning, and you can make them better, but there's still going to be an extremely high death rate. It's not the 80% that it was in New York and really good places, people dying. You know, at Rush, it was way lower than that. We were down in the single digits for deaths, but that's because we had so many different techniques. But the best thing to do isn't to rely on, you know, the fanciness of the hospital that you end up at, but to rely on the fact that you can control whether or not you're overweight, your body mass index more than 30, meaning that you're obese, and whether or not you're smoking. Okay, so focusing on our obesity epidemic based on that is something that's happening in the United States. When you look at the data for COVID-19, you get numbers like this. 3.68. Remember that hazard ratio? And I was talking about, you know, 1.2, that's a 20%. Well, 368, that's a 368% increase. This is of having a likelihood of somebody having a really bad outcome if they're overweight, a body mass index of over 25, not even obese at 30, but if you're overweight at all. So the time to lose the weight is now, and hopefully we're at the tail end of this pandemic. The fact that we have so much obesity is why the United States leads the world in COVID deaths. No one talks, well, actually they do talk about it, but they talk about it for a second, and then they move on to the next aspect of the news. But there are multiple, hopefully those of you who are interested in the biochemistry and the immunology will take a screen capture of this slide. But the fact of the matter is that obesity ruins your immune system. And so these unhealthy meals, red meat, unhealthy fats, sugary drinks, and not enough fruits and vegetables. And this has been going on for decades. And this was published just a few days ago. It was very disappointing. We thought that we were getting the message out. I always joke that, you know, I never mind if people don't pay attention to guidelines unless I wrote them. So I take it very personally that people are not actually listening about our message from the American College of Cardiology about fruits and vegetables. And apparently it's really not happening. You know, this publication was very sad, done by the federal government, asking people to just do 2 to 3 cups of vegetables per day. And it turns out that 90% of Americans do not do this. It's just so disappointing. Okay, so what do we get instead? This is our obesity map. So your body mass index, and for those of you who aren't, I'll keep referring to that, the BMI, body mass index. That is your your weight divided by your height in the metric system. And anything above 30 means that you're obese. If you're above 35, you're really obese. And if you look at the number of people who are obese, the darker states, the darker you are, the more obese people you have, more than 35% of the population. That is the kind of thing that you all know if you travel the country, that there are parts of the country that are worse than others. And then you have some places where, you know, a bunch of young executives and going in and out of Congress in DC and people being healthier in Colorado because they're skiing all the time. There are places where it's less, but there are places in sort of Midwest and South where the obesity problem is really bad. Okay, so you've seen this picture, right? I'm going to divide it up ethnically. Okay, so that is much better looking picture. And that's if you look at the non-Hispanic white adults. If you look at the number of dark states, it's just a handful. The number of dark states, if you take in just the Hispanic population, is much higher, 2 to 3 times higher. If you look at the Black population, it's almost the entire country. And so at some point, we have to look at our community, look at what are the things that are contributing to this, and see if we can't do something about it. Why? This is why. I think it's our patriotic duty to do something about this curve. We have a terrible life expectancy in terms of developed countries on this planet. We have the worst outcomes, and we spend more money than anyone else. And I just hope everyone just stares this and says, I'm going to change this. I'm an American. I'm going to change this. I'm going to be this person who lives like they're in Japan or something. Not going to cost the system very much with my own personal choices. And I'm going to live a long, productive life and see my grandkids graduate from college. These are choices that we make every day with our foods. Okay, and here they are. And I'm not saying it's totally everyone's fault, because there's a marketing issue that we have. And this marketing is very powerful. And if you look at how unhealthy foods are distributed in this country. You are really appalled by it. And then we have a large focus on weight loss and trying to make it better. And you get all these mixed messages. And so the Atkins people, which I'll talk about in a bit, tells you to eat nothing but animal products. And then Dean Ornish, the vegetarian guy, would tell you to eat nothing but vegetables. Well, which one of them works? Yeah, doing plant-based nutrition actually does better sustained weight loss when you look at the same people done in a randomized trial by Bree Turner McGreevy. The plant-based diet is going to be the winner. Moving on from obesity to correlates and having diabetes and having high blood pressure, everybody expects that you're going to get them, you're going to go and have them managed, and you're going to try to deal with all the complications. Well, how about prevention? We actually have good data that vegetarian diets, and that is, there are a variety of vegetarian diets. People who are half vegetarian, people who are vegetarian, but they still eat fish. Then there's the ovo-lacto, and a fair number of those because I'm showing you Adventist health studies, and the Adventists actually were telling people for decades to do eggs and milk. Now they're changing their tune after they saw all of their 30-year outcomes that the vegans, people who ate no animal products, were doing so much better. They were the only group that on average was not overweight, body mass index, again, greater than 25. They were the lowest amount of diabetes, the lowest amount of hypertension. And there was a big impact on death rate, about a 30% decrease. That's a hazard ratio of 0.7 for dying of heart disease of any kind. And if you looked at what happened over time, it seemed like their older people were getting more and more vegan, and the people who were not vegan were not around much anymore. And so that really is a very telling curve. Bottom line of their studies is that if you do a vegetarian diet, you're going to live almost a decade longer. You're going to be 30 pounds lighter, less disease, more life in your life. And so this is an opportunity for everyone to change to a diet that's going to not just enhance their weight and disease states, but actually feel better about themselves. Let's talk specifically about blood pressure, because almost everyone's blood pressure, if you don't have some specific disease that's causing it, so-called secondary hypertension, if you don't have a disease that's causing it, it's pretty much your diet. And people are eating too much sodium, and they're eating too much saturated fat, and they're overweight. And when you do a dietary intervention, like a vegan diet, you can get some massive decreases in blood pressure. And so this is the famous DASH trial. And you could just see starting off blood pressure in the 130s, ending up in the low 120s. When you do a diet that's low in fat and cholesterol, that would be much more of a vegetarian diet. So our 2017 American College of Cardiology guidelines were published, and we were the ones who changed the definition of high blood pressure from 140 to 130. And of course, we were accused of being in the pocket of the drug companies. That just meant that they didn't read the document, because this is what we were pushing. Non-pharmacologic. That means no drugs unless you absolutely need them. And what we're talking about is things that people should be doing all the time. So at least 150 minutes of exercise. And if you add these together, I'm telling all my patients to do 300 minutes. Aerobic exercise, dynamic resistance, that's like doing weights and isometric resistance like Pilates and planks and that sort of thing. Each one of them has a drop in blood pressure of 5 millimeters or 4 millimeters. Cutting back on the alcohol, that also lowers the blood pressure. Losing weight. Everyone should please remember your sodium on a daily basis should be no more than 1,500 milligrams. And if you're and get the potassium as high as possible. That's actually very easy to do these two if you're doing this. And that is a heart healthy diet. It's rich in fruits and vegetables and whole grains. That in and of itself will get you 11 millimeters off your blood pressure. So if you add up all of those things, you can get 20, 30, 40 millimeters of mercury off your blood pressure. Who needs medication if you do the right thing with your lifestyle? I'm going to talk about diabetes for a moment. People don't realize that refined grains like white bread are treated like by the body just like sugar, of any variety of sugar, including fruit sugar. The fruit sugar is healthy if it's in the fruit. If you take it out and you make like high fructose high fructose corn syrup, which you'll see in everything, including barbecue sauce and and even ketchup. When you take that in, you get a spike in blood sugar, but you also get a spike in insulin. And insulin is not our friend in cardiology. It creates badness in the cholesterol and badness in the blood pressure, and it creates diabetes, all of which make plaque, or so-called atherosclerosis. Those plaques are the bane of our existence. It's what we spend all of our time trying to open up, get rid of the plaque, squeezing it, bypassing it. If we could change the underlying causes, we could have much better outcomes and so much fewer heart attacks, stroke, peripheral artery disease, erectile dysfunction, aortic aneurysms, which people think, wait a minute, that's where your aorta gets enlarged. That is still a manifestation of atherosclerosis. It weakens the wall, and then the high blood pressure balloons out the thing, and people die of aneurysms. It's all really the same disease, just one form will narrow it. You get a narrowing in one place and an enlargement in another place. It's still the same disease. So don't sugarcoat it. Eating sugar will actually mess up your cholesterol, give you diabetes, particularly if you're not doing the exercise well, and it increases inflammation. Now, many of you have actually heard about cholesterol causing heart disease. Most people have. Then not as many people have heard the data from Harvard, from Paul Ricker, that inflammation causes heart disease just as much as cholesterol does. And so you'll see, now most people actually have heard this. You hear that, I got the flu and it gave me a heart attack. Flu shots decrease heart attacks in a community by 60%. That you get a dental abscess and you end up with a heart attack. Those are all examples of inflammation, and COVID-19 does the same thing. The more inflammation you have, the higher your heart attack risk. Well, just drinking a sugary drink increases your inflammation markers, such as C-reactive protein. So it's something that we really don't need to add to our bodies. And this is the data. You know what your hazard ratio is. You know it should be 1.0. And when you get about 12, 13% of your diet being sugar, then you start to see the increase in death rate. And the more sugar you do, the more you die. So let's back off of it. We actually had this data for a long time in our nurses' health study. They said, okay, what's making 30 years of outcomes of nurses' health study? What makes nurses die? Number one was getting older. Yeah, we probably could have figured that one out. But number two was actually diabetes. Number three was smoking. But in the upper right-hand corner here, there was dietary stuff. You eat fiber, your risk of dying goes down by 16%. You eat a hamburger, cholesterol goes up by 17%. But people kind of ignored this for the longest time, that a sugary drink, or a donut increased your death rate more than eating a cholesterol item, such as a hamburger or a steak. And so something that was buried in the literature, and then it started to become much more recognized as more data sets started looking at long-term consumption of sugar-sweetened beverages, increasing death rate. The numbers get really bad. They're worse for actual sugar than they are for artificial sweeteners, but artificial sweeteners do the same thing, just not quite as bad. Here's another hazard ratio for you. Please don't be a high consumer of artificially sweetened beverages, because you can get some very high increase in risk of dying. When you look at diabetes, though, and so many of our patients are diabetic, is there anything that we can do about it? Well, first of all, you can prevent it by doing plant-based nutrition. And there's a good curve here that shows that hazard ratio going down, 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 the more plant-based you are. So it's very simple. It's exactly what the US government was trying to tell people: eat more fruits and vegetables, and you will see a lower rate of these risk factors, including diabetes. Okay, so once you are diabetic, does it make any sense to change your diet? You bet. Every diabetic in the group listening today knows that you're supposed to be following your hemoglobin A1C, and your hemoglobin A1C will fall with a vegetarian diet. The one that didn't work so well was the lacto-vegetarian, because the milk is actually not good for you, but the low-fat vegan diet consistently lowers the hemoglobin A1C. I threw this one in there because not everybody recognizes that sick people feel sick. It sounds like silly, but it's actually very true. And the sense of well-being is actually lowered when you're sick. And so a plant-based diet actually does, if you do an intervention in a diabetic, you get an improvement of the emotional well-being, not just the physical, less depression, better quality of life, better overall health, as well as the stuff that you would imagine, hemoglobin A1C, weight, cholesterol, and overall risk. So bottom line is diabetes is associated with the things that we eat, particularly refined carbohydrates, but also red meat. And if we avoid the saturated fat, for example, from animals, that increases both cholesterol and increases weight so efficiently, we can actually lower our diabetes rate. Everybody should be a thin, walking, everyday vegetarian, and this diabetes issue would go away. Okay, I'm going to talk a little bit about fat because this is highly controversial. You see it all the time. People say that saturated fat is actually good for you. Nothing could be further from the truth, except trans fats, which are now illegal in 4 countries. So I don't have to talk about it much anymore because the United States is now one of them. But monounsaturated fat and polyunsaturated fats, mostly from vegetable sources, actually do decrease the death rate. Hazard ratio of 0.73, that's a 27% reduction if people would just be conscious of what kind of fat they're going to eat. Now, there are plenty of vegan people who are saying you shouldn't eat any fat at all. The fat you eat is the fat you wear. That's actually true. And so, but we're talking about in terms of your cholesterol and in terms of overall mortality, the data, if you're going to eat fat, it should not be saturated fat, which means lessening the animals. This one came out, the Pure trial a few years ago, and shocked the world, saying that eating fat was actually better for you than carbohydrates. They finally did correct it. They're friends of mine. I said, guys, you buried it in the methods. The problem was carbohydrates, that is starches, breads. If you're doing them with whole grains, it's good. And if you're doing them with refined grains, that white bread, the pretzels, the bagels, then they turn right into sugar and generate the insulin, as we said a few slides ago. And so, yeah, they were talking about replacing carbohydrates with fats was going to lower the death rate. Yeah, that's because refined grains are actually poisonous, essentially. And so, yes, dietary fats are better if you're going to have, if your body can tolerate it. Yes, eating more healthy fats, olive oil and the like, is going to be better than saturated fats. Okay, I'm going to switch over and talk about cholesterol and inflammation. And this is another sad realization. This was a little later, so this is like 4 or 5 months into the pandemic, when we realized that high cholesterol actually was helping the COVID-19 virus get into the cells. It actually uses cholesterol to get into the cells. So if a person is running around with a high cholesterol level and they get COVID, they're going to get more serious infection, because instead of just running around the bloodstream harmlessly, it's actually going to go into cells, particularly fat cells, where they can reproduce. Does cholesterol get affected by what you eat? Absolutely. The more animal products you eat, you're getting a massive amount of cholesterol. And there's essentially zero cholesterol in any plant-based foods. And egg whites are actually pretty good in terms of being low cholesterol. Great. Only problem is people are eating egg whites with egg yolks, and it's a massive amount of cholesterol. The only thing that's worse than egg yolks is brains. And I know a lot of people whose families are from the South, they actually ate brains, hoping that everyone is tamping down on that. Can you intervene on your cholesterol and your inflammation with diet? Absolutely. And this is one of the first studies in the Journal of American Medical Association, 2003, showing that if you did an intervention with a plant-based diet and with fiber and soy protein and nuts, in this case almonds, that you would see a dramatic fall in LDL cholesterol. And if you took a statin, you'd also see a dramatic fall. And when you compare the results between the statin and the vegan diet, they were almost identical. The C-reactive protein went down, the LDL cholesterol went down. And so this would lower people's risk tremendously. That anti-inflammatory stuff has actually been reproduced, published just a couple of years ago, showing that the American Heart Association, very proud of the American Heart Association to publish a study saying that their diet was terrible, but they knew that they should move on because they did work with us on the guidelines. But a vegan diet lowers your inflammation as well as your cholesterol and your weight and your blood pressure and your blood sugar, where you don't get that kind of effect with the American Heart Association diet because it has animal products, less red meat, more fish, more chicken, still not helping, and not as much as it could be. Okay, if we look at cholesterol and cholesterol interventions, have to admit that unlike what you've heard in the literature, the cholesterol doesn't matter what you eat, it's your genes. That is just completely not true. When you do an intervention to lower LDL cholesterol with a vegan diet, it's very successful in most cases. And the data is just a massive amount of it. And so it's only people who are pushing cholesterol consumption, such as the Egg Board or Cattlemen's Association, they're the ones going around saying that there is no relationship between cholesterol and what you eat. Nothing could be further from the medical truth. I'm going to talk about some of the patterns that we see, particularly for our audience. And I grew up on the south side of Chicago, and so when they say Southern diet, I'm thinking south of Roosevelt, because that is exactly the kinds of things that we were eating on the south side of Chicago. And so, but being respectful to the authors, this was talking about, the Regards trial is talking about the Southern dietary pattern in the stroke belt. This is University of Alabama, Birmingham, but it's in northern cities as well. And what you see is a survivor plot over several years of adults with risk factors eating that Southern diet, which is like the fried chicken, putting ham hocks, neck bones in the greens, not yams, but candied yams, sugar sweetened beverages, and the like, and a lot of organ meats, the chitlins and the like. And if you eat these things, for all of the reasons that I've been talking about for the last 30 minutes, you end up with this burden of heart disease, burden of kidney disease, and stroke. It turns out that we now have good amounts of data that what is it about that diet that kills people. So what you're seeing here is increase in deaths, and each one it has its own cut point. How much do you have to do in order to die? Well, for sodium, it's 2,000 milligrams a day. And so our recommendation of less than 1,500 makes sense. Not enough nuts and seeds. High processed meats. I hope everybody captures that high is defined as any, greater than 0, okay? So processed meat, which would be like lunch meat, bacon, ham, hot dogs, sausages, they should essentially be never events in the human diet. Okay, not enough seafood. Why does seafood come out as a good thing? Because when you replace other types of red meat, particularly processed meat, with seafood, people do better. Doesn't mean that it's good for you. It just means that if somebody's going to force you to take cyanide or arsenic, you're better off with the arsenic. That's what this is saying. Not enough vegetables, not enough fruit. Oh, sugar sweetened beverages. How much is safe? 0. Okay, so I'm hoping that everyone will toss those right out of their refrigerator along with the bacon and the ham. Okay. Have to shout out to so many people nowadays who have changed their diet because of animal rights concerns or the society or greenhouse gases, and have gone to a vegetarian diet. But it's not a healthy vegetarian diet. There's juices, and they're juicing. A lot of people are thinking that it's helping them, but when you get rid of the pulp, you're actually taking too much sugar. Refined grains, taking a potato is great, but taking a potato and frying it is not so great. And so when you look at that all together as an unhealthful plant-based diet, you see an increase in death rate. And that dotted line, that hazard ratio, is actually worse than eating animals. And so you might be saving the environment, but not saving yourself. So hopefully people will understand that when we're talking about a vegan or vegetarian diet, we're talking about a whole food plant-based diet, not junk food. Okay. More data that was published just a few days ago talking about people not eating enough grains and eating refined grains instead. and seeing hazard ratios just to what you'd expect based on what I've mentioned so far. The more refined grains you eat, the more cardiovascular disease you're going to get. I'm going to spend the last few minutes talking about some of the damaging data that has come out with keto diets, because everybody's doing them to try to lose weight. They're very effective in causing weight loss. But if you just Google the phrase keto diet mortality, you see all this data come up. This is from Greece, saying it's a 22% increase in death. This is from Japan, saying that it's a 31% increase in death. This is from the United States, saying that it's an 18% increase in death if you do the red, if you're eating keto with animals, and an 18% decrease if you're doing it with plants. And so it's not the keto diet that's the problem. The problem is the animal products that you're using to do the keto diet. Okay, the more keto you are, the higher the death rate. And if you've had a heart attack in the past, the increase in your death rate of 53% is something no one really should be doing a keto diet unless it's done with plants. If you're trying to explain this to somebody, tell them there's two things. And this is the lipids, which is your cholesterol, and the inflammation. And those markers are worsened significantly, and that's associated with increase down the road, heart attack, stroke, and death. And so the science is very clear. Their cholesterol, in some of my patients, the cholesterol would actually triple when they would do a keto diet doing bacon and eggs. So we have really good National Lipid Association folks who put together an article saying exactly what happens when you do this diet. And yeah, if you lose a lot of weight, your blood sugar will go down. And that's what they're bragging about, that it controls diabetes. Yeah, but at the cost of heart disease, it isn't worth it. What's the wrong with it? It's got eggs. And the more eggs you eat, the more you die. And so it takes only about a half an egg consumed per day to increase the mortality rate. And another publication from just a few weeks ago confirmed it in a completely different population. The more eggs and cholesterol you're eating, the more people die, and cancer mortality, not just cardiovascular disease. And it's something that everyone should be aware of, because there's such great articles or advertisements saying that people should eat eggs when it really isn't true. The other side of it is the red meat. We've had this data for years. This is 2012, almost 20 years ago, or 10 years ago, saying that the more red meat you eat, the more you die, and it's cardiovascular disease and cancer. That is dose related. And people who say moderation have to realize that the biggest jump in the death rate is between 0 and 1 serving per day. We have massive amounts of data from Harvard, the Physicians' Health Study, our Nurses' Health Study, all of them saying that there are no safe animal products. The best thing to do to substitute for red meat would be like soy protein and plant-based proteins and nuts and legumes. Those actually do work pretty well. Talk about the Mediterranean diet for a moment, because it's very famous, New England Journal of Medicine. And it's one of the strangest things in my medical career, where people will look at these survival plots and say, oh, look at that, controlled diet died this much. If you did the Mediterranean diet, you died this much. Well, they were actually talking about heart attack, stroke, and death all together. And they're talking about a 30% reduction if you get rid of the red meat and go with extra virgin olive oil or nuts with fish and a little chicken here and there. Sounds good, right? Except for the panel B. Panel B has been there with every publication saying the same thing, that the death rate, the total mortality, wasn't different between the three diets. And if you blow up the right-hand table, what you see is that the big difference was in stroke. And if I was a neurology doctor, I'd feel pretty good about this. But as a cardiologist, noticing that the diet does not change the heart attacks, doesn't change cardiac death, and doesn't change all-cause death, means that this is a worthless diet, and it shouldn't be labeled by U.S. News and World Report as the #1 diet for human health. Now, they're friends of mine too. And I kind of said, guys, you're talking about, why didn't you look at a vegetarian diet? And they said, well, we kind of did. And they went back and analyzed their data. And I hope everybody captures this. This is that same data I just showed you, but it's turned on its side. And that is, instead of how people were randomized, they said, how many vegetables did you eat? And the people in the top quintile, as it's called, because they divided them into 5 groups, the top quintile actually ate the most vegetables, very little animal products. They had like a 40% reduction in death. And so the Mediterranean diet works just fine, as long as you don't eat any of the animals. There are plenty of Mediterranean style foods, including the nuts and the olive oil, that seem to be associated with longer life expectancy, as long as you don't eat the animal products. Okay, so last week there was a nice publication specifically about this, Mediterranean versus vegan. Congratulations to Neil Barnard, showing that a low-fat vegan diet did so much better for all of the risk factors and the weight. And I started this group at the nutrition group of the American College of Cardiology. So this, of course, was going back and forth between the Mediterranean people and the vegans, back and forth. Bottom line is, yeah, people did better with the vegan diet, and that's because it doesn't have animal protein. That's all there is to it. This data has been out there. Hopefully, everybody can just stare at this title for a moment, because you're going to laugh at this in a minute. Journal of American Medical Association, looking at that title, animal versus plant protein, showing that if you have any risk factors, doctors and nurses, then there are no safe animal products. Let me blow that up. That is, you will, the fish and the chicken and the dairy, 6 to 8% increase in death. Eggs would be worse than red meat. Processed red meat is worse than everything, okay? Well, here it is again, 3 years later, published, same journal, same title, but this is from Japan, and it said the same thing. If you want to avoid cardiovascular disease, you avoid red meat, chicken, fish, and this decrease in death is for every 3% of plant protein that you substitute for animal protein. So then, whoa, they published it again? Completely different group. This is another National Institutes of Health data, same journal, same title. Again, just substituting in their model plant protein for animal protein, saying a decrease but it wasn't just heart disease. It was cancer as well, stroke, respiratory disease. Thus, and every red meat, every egg protein, they all contribute to death of our population, death and illness. Okay, so where should you get your protein? Well, turns out that if you want to have your best outcome and have the hazard ratios be on the left side, meaning that you've improved your outcome, what you really want to do to avoid heart attack and stroke and heart failure is to do plant-based diet. Now, I know everybody can't eat a tofu beast, but it's really important for everybody to recognize that vegetables do have a lot of protein, that beef and peanuts are the same, egg whites are less than quinoa, and soy and lentils and chickpeas actually have more protein than chicken. So people talking about eating animal protein to get their protein, it's just scientifically not true. And you end up with this compound, trimethylamine N oxide. Okay, so that is what happens when you eat animal products, and then you have your GI tract has bacteria in them that are really bad for you because you ate dead animals, and those bacteria make a compound that gets turned by your liver into trimethylamine N oxide. Please write down those 4 letters and look into it. By the time you're done Googling it, you will be a vegetarian, because it'll make you realize that it's making the plaque grow, rupturing the plaques, and then your platelets, which some of you have heard of, taking aspirin so your aspirin will stop your platelets from aggregating and causing heart attacks and strokes. Well, you're ruining your aspirin with your TMAO level is high because you ate animals. It also is associated with heart failure. And so the heart failure is important because we have data that says when you have heart failure, which is so ubiquitous in the Black community, particularly, you get about a 41% decrease in heart failure if you do a vegetarian diet. And so that plant-based diet decreases heart failure. The Southern diet particularly increases it. But we've had this data. It's not just our community, it's all over the world. The more processed and unprocessed meat you eat, the more heart failure you get. I want to focus just for a minute, because I want to leave some time for questions and answers about the microbiome. This is something that has all of a sudden became really important. The data I was showing you from Cleveland Clinic about the GI tract and the bacteria and eating dead animals, and the same bacteria that make that meat rot are actually inside your gut if you eat that meat before it rots. and you may cook it, but it still changes your microbiome. And it turns out that a publication just a few weeks ago indicated that it was the microbiome that was causing all the COVID illness. And so if people are eating a vegetarian diet, they have the GI tract bacteria that are actually more amenable to not having a ridiculous immune response and all that cytokine storm that people have, and the increase in the inflammatory markers that takes people out with COVID. So this is finally a good explanation of why it is that vegans don't tend to get serious COVID illness. They all get it if they're exposed, but they don't get very sick. And if anybody, please let me know if you know of one, a vegan who actually got hospitalized with COVID. So far, my count is 0. That doesn't mean it's safe. That means that you become an asymptomatic carrier. So please do the distancing and masking, because it's still a dangerous disease for somebody who's not a vegan. Okay. So no question that when you change to a vegetarian diet, you will change your microbiome completely. The more animal products you eat, the more these bacteroides species you get, which really are associated with worse outcome. I want to spend just a minute talking about kidneys and hearts together, because it's a big deal that when you're eating animal protein, you're actually attacking your kidneys. And I'd left this out of my talks for decades, knowing, because I had written one of the original articles on it a long time ago, but it's time to put it back in, because the data is so overwhelming that when you eat animal protein, it's toxic to kidneys. It increases the progression from chronic kidney disease to kidney failure and going on dialysis. And people do not generally die of kidney disease. They die of heart disease when they have kidney disease. And so red meat increases the risk of going on dialysis. The data is very clear. And so we add that to our list of many things of why people shouldn't be eating red meat. So diabetes, stroke, sure. Heart failure, sure. Let's add kidney disease to that list. We have multiple mechanisms. One, if you want to do a screen capture, one of them that we should point out is heme iron, because you now see that in some of the plant-based milks or plant-based meat, particularly the Impossible Burger, and hopefully they'll change that. I know that's what makes it taste bloody, and that makes it test well, but it isn't particularly healthy, because heme iron does increase plaque. It produces plaque and then upsets plaque, makes those plaques unstable. I'm going to spend my last minute before opening it up for questions talking about doing an intervention in our community. And I was very privileged to work with President Obama's old church about trying to implement our ACC guidelines, fruits and vegetables, nuts, whole grains. We skip the fish, of course, because we know that increases mortality a smaller amount, but it still does increase mortality. Trying to replace all the saturated fat, get rid of the sodium and cholesterol, and avoid the processed meat. And of course, there's no trans fats in the United States, hopefully anymore. That nutrition intervention actually went pretty well. We asked people to go on a vegan diet that we supplied them for 5 weeks and just watch what happened. Their insulin levels fell. Their TMAO levels fell. Their LDL cholesterol, the bad stuff, went down substantially. Blood sugar, their weight, everything. One of the smallest ones was the hemoglobin A1C we talked about for diabetes. That was really highly significant because that little tiny change happened in everybody. It was pretty amazing. So just 5 weeks is all it took. We had pretty good completion rate, really decent adherence, and the risk factors that we measured were so much better that when you put them into our little risk calculator, we found that people were dramatically better. We were actually able to eliminate about 19% of the risk, provided they continued it for a 10-year period. 19% of that 21% increase in risk in African-American adults that I'm always trying to get rid of. We got a lot of press, but what we need is people to really pay attention to the message that is changing your diet will change your risk. I want to please take a capture of this one, if you will. It's the Heart and Soul cookbook put out by the Association of Black Cardiologists. It came out just a few months ago, and it's a good way to start your plant-based journey. So in summary, as I open it up for questions, we are living in a dual pandemic, no question about it. And we need to advocate for risk factor reduction because those risk factors are leading to the issues that we're struggling with that are cardiovascular as well as COVID. And so please, everybody, think through every food choice that you're making. With every meal, you're determining what your outcome is going to be, and your outcome affects your family and your community and your country. And so, we can spend all of our money on healthcare if we want, instead of education and roads and bridges. But I think it's everyone's patriotic duty to be a vegan. Thank you very much.
Thank you so much, Dr. Kim Williams. That was a lot of information, and many people watching. Thank you so much. It was so much information in such a short time. So thank you for sharing a lot of awareness. With what little time we have left, I have a number of questions, but I saw a consistent question about how many grams of fiber should one consume a day?
So actually, it turns out that for every 6 grams of fiber, that there's like a 15% decrease in mortality. So there should be, I would say, do as much fiber as you can. It turns out that the fiber is actually changing the microbiome. That is, the bacteria that break down the fiber and get the nutrients out of it, those are the good ones. Those are the ones that don't create inflammation. So please, I wouldn't say, how much do you need? I would say, how much can you consume?
Okay. There is just another question I was curious about, because we hear a lot about alkaline diets versus acidity. Can you speak about, are alkaline diets healthy?
Yeah.
And is that something we should consider?
So if you look at, this is a good one that everyone should do with their search engine, and do alkaline diet outcomes or mortality or heart attack, you'll see that there's zero data. And so do I turn green with envy sometimes when I see that somebody's got zero data and they're marketing it and making millions? I figure, gosh, I could start that scholarship fund for Chicago Public School to go to University of Chicago if I'd had some idea like that where I could make massive amount of money off of zero data. Because as far as I can tell, there is no data. And you'll probably see that on the little disclaimer on the little, on all of the supplements, there is no data that this actually fixes any disease. On the other hand, an acidic diet, if you're talking about the acids of animal protein, that's really important. And people don't realize that dairy has, with that animal protein being buffered by the calcium out of your bones, that dairy can actually worsen your bones. They don't realize the data on breakdown of animal protein, so that it's toxic to kidneys, as I mentioned a few slides ago. I'm hoping that everybody will realize that a whole food plant-based diet, not really a gimmick, is what we really should be doing.
Okay, my last question, because I know you have to go, detox. We see a lot of information about detox. Is it important to even start this journey of a plant-based diet with the detox?
So there's a couple of different types of detox, and people are talking about water fasting as a detox. Water fasting actually does have data for weight loss. The problem is that you really have to associate it with a behavioral change, because people will just, they'll lose 30 pounds and then they'll just rebound back to it. Then you're talking about detox in terms of just a whole food plant-based diet. Yeah, well, people should be doing that whole food plant-based diet anyway. Though the other one that people talk about would be, doing, colon cleansing and things like that as part of their detox. There really isn't a lot of good data for that, but I have to say that even though it's something I'm vegan for 20 years, so I probably wouldn't come up with me, but I would say that the more data that we have on the microbiome being important, and there was even it sounds really strange to say this in public, but there was actually a medical study showing that you can improve people's health by infusing the feces of a vegan into a non-vegan. Just for the reason that I was just talking about, that is, they actually do have better bacteria in their GI tract.
Wow.
And so, if this is true, then I'm saying that all these people who've been pushing colonics for years, now is the time to go and get data and actually prove that it works. because we've done so many things in medicine that made sense, and then they turned out that they didn't work. What's the most recent one? Probably the HDL cholesterol. We've ever heard that that's so healthy for you, and the higher it is. Well, it turns out the higher your HDL cholesterol, the more you have heart attacks. We had that wrong for 60 years. So that's just one of many examples. And I would say, putting oxygen on people with a heart attack, totally a bad idea. And so what I'm saying is that, in God we trust, everybody else bring data. Okay. And so those people doing those colonics, if you're changing the microbiome and making people better, let's collect some data and show that it's true. All right.
Thank you so much for a phenomenal presentation and taking the time with us.
Absolutely. All right. Thank you so much, everyone.
Thank you.
All right. Bye-bye.